Hey, this is Nurse Ben, and today we will be going over all the key points you need to know for the nursing exams as well as NCLEX. Our today's topic is electrolyte imbalances. I hope this video will help you to know all the signs and symptoms of electrolyte imbalances. To answer every question correctly on this subject, memorization is not the answer. We are able to recall all the symptoms and indicators of a single electrolyte imbalance, but it is impossible to recall the symptoms of all electrolyte abnormalities. Let's dive in. First of all, let's discuss what is common in all electrolyte imbalances. The earliest sign of any electrolyte imbalance is paresthesia. And all electrolyte imbalances cause paresis, which is muscle weakness. Let's start with potassium. Memorize this sentence. Do the same as prefix except for heart rate and urine output. What does that mean? It means if potassium is low, then all other systems are going down too, like bradypnea, lethargy, except heart rate and urine output. Heart rate will go up and urine output will increase. Let's write it down together, so that you can get a better idea. In case of hypokalemia, you will see lethargy, constipation, flaccid muscles, hyporeflexia, bradypnea, increased urine output, and tachycardia. In case of hyperkalemia, you will see irritability, tachypnea, diarrhea, hyperreflexia, oliguria, and bradycardia. And some of the most important points you need to know are: D5W with regular insulin is the fastest way to lower the potassium level. It is a temporary fix but works fast. K-Exolate is also used to get rid of potassium. K-Exolate works late but it is permanent. Calcium. Memorize this sentence for calcium. Do the opposite of prefix. Nuchal and nerves. If it is related to muscle and nerves, blame it on calcium. And calcium and magnesium have same signs and symptoms. Let's write it together. In case of hypocalcemia, everything will go up, like agitation, tachypnea, tachycardia, diarrhea, hyperreflexia, seizure, schwastexine and trusosine, spastic muscles. In the case of hypercalcemia, everything will go down, like bradycardia, bradypnea, flaccid muscles, lethargy, and constipation. And as I mentioned before, both calcium and magnesium have same signs and symptoms. Sodium. If the sodium level is low, that means we have more fluid in the body. So in case of hyponatremia, we restrict the fluid and give Lasix. If the sodium level is high, we are dehydrated. So in case of hypernatremia, we see hot flushed skin, give lots of fluids. To effectively respond to inquiries on this subject, you must know these information. Because I am aware that I did not have the stamina to watch all of the lengthy movies covering simply the fundamentals while I was a nursing student, I aim to keep all of the videos brief and simple. I'm attempting to create videos exclusively with this environment, which is saturated with protracted videos and lectures. Hope you had fun watching this. To see more content like this, kindly support this channel. Blessings to you.